Infertility means that a couple has regular unprotected intercourse for 12 months with no pregnancy. About 1 in 6 couples struggle with infertility, and around 35% of cases come from female factors, around 30% come from male factors, and the rest are combined or unexplained. The strongest single predictor of infertility is age, because a woman's egg supply and egg quality decline steadily over life. At age 25, a healthy woman has about a 25% chance of conceiving in each menstrual cycle. By age 40 this chance drops to around 5%, mainly because the number of high-quality eggs becomes extremely low. At age 45, the chance falls to below 1% per month, and almost 90% of remaining eggs are chromosomally abnormal, which explains why even when pregnancy occurs, almost 80% end in early miscarriage. Women are born with all their eggs, and no new eggs are created after birth. An egg released at age 40 has been inside the body for 40 years. Over time, the mitochondria inside the egg, which supply energy for early embryo development, become weaker. Mitochondrial function declines sharply after age 37. Decades of oxidative stress, low-grade inflammation, environmental chemicals, smoking, and radiation gradually damage egg DNA. The structure that controls chromosome division, called the meiotic spindle, also becomes unstable with age, causing chromosomal errors, failed implantation, and early miscarriage. That is why age is the strongest predictor of success, regardless of test results. To understand ovarian reserve, doctors use anti-Müllerian hormone and the antral follicle count. These tests measure the quantity of eggs but cannot measure quality. A woman of 40 may have a high AMH and a deceivingly good follicle count, but most eggs are genetically abnormal. A woman of 25 may have a low AMH, but because her egg quality is excellent, she can still conceive naturally with good success. These tests predict how many eggs will be retrieved during fertility treatment, but they do not perfectly predict natural pregnancy. Male fertility is equally important. Men produce sperm throughout life, but aging and environment reduce sperm quality. Oxidation and inflammation damage sperm DNA and increase DNA fragmentation over time. After age 40, sperm motility decreases and the mechanisms that build sperm become less precise, creating abnormalities. At age 30, sperm count and motility are usually high. By age 40, DNA fragmentation can reach 30%, increasing miscarriage risk by about 20%. During the last 40 years, global sperm concentration has dropped by nearly 50%, linked to obesity, chronic inflammation, plastics, heat exposure, alcohol, cannabis, poor diet, stress, and endocrine disrupting chemicals. One of the most important causes of infertility is male factor infertility, which is responsible for about 30 to 50% of all infertility cases. Most men feel completely normal, so the problem is silent and only detected by semen analysis. In many cases the most important issue is varicocele, which affects nearly 40% of infertile men. Varicocele causes warm blood to pool around the testicle. Sperm require a cooler environment. When temperature rises, oxidative stress increases and sperm DNA fragments. Surgery to repair varicocele improves sperm parameters in 60 to 70% of men, especially in younger age groups. Male infertility can also come from impaired sperm production, where the testicles fail to produce enough healthy sperm. This ranges from low sperm count to complete absence of sperm. Reasons include genetic conditions such as Y chromosome microdeletions, hormonal problems, radiation, chemotherapy, or severe inflammation. In some men, the problem is not production but obstruction, meaning sperm are made normally but cannot exit because the ducts are blocked. This occurs after infections, after vasectomy, or because of a congenital absence of the vas deferens, which is often linked to the cystic fibrosis gene. Another major cause of infertility is ovulation disorders. These occur when the ovary does not release an egg, releases it irregularly, or the egg does not mature. Without reliable ovulation, pregnancy is impossible even with perfect timing. The most common reason is polycystic ovary syndrome, when testosterone is high, insulin is high, and the ovary stops functioning normally. This imbalance blocks egg development, so many cycles pass without ovulation. Women with PCOS often have irregular periods, acne, oily skin, or excess facial and body hair. Many gain weight easily, especially around the waist. A classic sign is having cycles longer than 35 days or fewer than 9 periods per year. Other ovulation disorders come from thyroid disease, hyperlactin, chronic stress, very low body weight, or perimenopause. Ovulation disorders are important because they are often reversible, and when ovulation becomes regular, monthly conception rates may reach 20 to 25%. Another important cause is fallopian tube damage. This explains about 20 to 25% of infertility and is often completely silent. The tubes must be open and healthy for the egg and sperm to meet. Past chlamydia or gonorrhea infections are the most common causes, even when the woman never knew she had them. These infections cause microscopic inflammation that scars the tubes over years. Other causes include pelvic inflammatory disease, abdominal surgery, a ruptured appendix, or endometriosis. Many women with tube damage feel normal. A warning sign is an ectopic pregnancy, because a damaged tube cannot transport the embryo properly. If the tubes are mildly damaged, natural conception is still possible, with a monthly chance of 5 to 10%. If both tubes are blocked, natural conception is nearly impossible, but in vitro fertilization bypasses the tubes and offers a success rate of 30 to 50% in younger women. Endometriosis is another major factor. It affects about 10% of women, and 30 to 50% of them struggle with infertility. Endometriosis happens when uterine tissue grows on the ovaries, tubes, pelvis, or bowel. Every month this tissue bleeds and causes inflammation, adhesions, and scarring. It can distort the ovaries, create endometriomas, and change the pelvic environment so the egg and sperm cannot meet easily. A hallmark sign is severe period pain that begins before bleeding starts and continues through it. Some women have pain during intercourse or pelvic pain throughout the month, while others have infertility as the only symptom. Mild cases often respond to hormonal treatment. Surgery can remove adhesions and improve natural fertility in moderate cases. When these methods fail, or when age becomes a limiting factor, IVF is the most effective option. The final important group is unexplained infertility, which affects 15 to 30% of couples. In these cases, ovulation is normal, semen is normal, the tubes are open, and the uterus appears normal, yet pregnancy does not occur. This usually reflects very subtle issues with egg quality, sperm DNA, early embryo development, or implantation that cannot be seen with routine tests. Many couples with unexplained infertility conceive naturally over time, with yearly pregnancy rates of around 10 to 15%. When natural conception does not occur, treatments like ovulation induction or IVF usually work well because all basic systems are functioning.